Like every complex healthcare system, we face many challenges in ensuring that we provide truly integrated care. Timely quality care is about transforming the way we work. It's about moving away from traditional, departmental, siloed ways of working to really focus on the patient journey. It's about innovation. It's about process improvement. It's about listening to our staff and getting them to talk to each other and simply making things work.
In times past, we've fought against inpatient units, and there's been friction between our department or any emergency department and the functioning of the rest of the hospital. But this brought the whole hospital, clinical and non-clinical staff, into promoting ED flow as a measure of patient care.
It's a shared understanding of expectations of our service for the patient. In doing so, we all are pulling together to move the patient from the ED into the ward and into, hopefully, home.
It's how we all impact along that process and how we all play a role in the patient's journey. And I think that really goes through into our ward culture and how we work as an interdisciplinary team. Everyone taking ownership of their part of the process, but also working together to make the best patient experience that we can whilst they're in hospital.
Staff at Alfred Health have two main jobs. One is to be the best healthcare professional they can be. The other is to ensure that they're constantly looking at improving the care we provide to our patients.
So initially there were perhaps consultations which may take place tomorrow. Now we expect the consultation to take place today. But it means that decisions are made quickly, which means that the patient is moved along in the process of getting better.
People realise that because radiology is a significant or an essential part of the diagnosis and planning management for a patient's treatment, they can see that the performance of imaging within 24 hours is, when possible, pivotal for that.
We are more involved and expect to be more involved with the care of these patients as well. So I guess that's an improved outcome for the patient. Once again, having that more timely and early physiotherapy intervention or allied health intervention.
Patients are coming through the system a lot quicker. They're getting to see their care providers a lot earlier in their journey, and I think this has really benefits for them long term. They know who's involved in their care, they know who to turn to. I think they feel more engaged in the process from the outset.
It's really nice, we're actually getting a lot more compliments now than what we used to get, and it is very much about patients being informed of what's happening to them in a really timely manner, and patients feeling listened to and supported, and having a short time here in the department, you know.
ED length of stay has shortened, and prolonged ED length of stay is well known to increase patient mortality. So we have the quantifiable aspect that has shown that patient care has improved.
Since timely quality care started in 2012, we've come a really long way, but there's always more work we can do.
I don't think you can have a successful transformation in a place like Alfred Health or any hospital unless you have buy-in by everybody. You can't have one group just hanging out in this particular exercise because it's an integrated system and we depend on each other really. It's a team.
Everyone's on board with the same principles, and ultimately I feel like everyone's here for the same goal of positive patient outcomes, which I think timely quality care really helps.
We've removed a lot of the waste and a lot of the duplication and a lot of the frustrations, I guess, that clinicians find, that, you know, you've got a bit more of a cohesive team, and, you know, it's a much nicer place to work.
This program makes sense. It's based on the patient experience. By providing time and appropriate care, it's not a hard sell, so getting staff on board is relatively easy.